News 46. Local coverage you can count on.
Welcome back to the show. Our first guest, we have Brad Cheek, and I remember that because I'm into visuals. Brad Cheek, who is the administrator of the Pahrump Valley, if I say it wrong, Rehabilitation Center.
Pahrump Health and Rehabilitation Center.
Health and Rehabilitation Center, along with Karina, who is the director of nursing, and Karina, your last name is Denhart. I didn't cheat too bad.
No, you didn't.
I got the first name right. And we do know that there is a movie called Karina, but of course I forgot all about that. Anyway, they're both here, and we're going to be talking about the Rehabilitation Center. But I think my first question really is, what is the function of the center itself?
That's a very good question. First of all, thank you for inviting us on today.
Oh, you're more than welcome. And he's really, okay, be careful. He's really nervous. Well, a new sponsor who's really nervous, so I'm going to just say, okay, Brad.
There we go.
Just chill.
I'm good.
All right,
well, the Pahrump Health and Rehabilitation Center is a facility for if and when someone needs additional care in their life that is not a hospital stay, and they really can't go home anymore. We're there to provide skilled nursing. And some people stay on as far as long-term. Some people just go in for the rehabilitation side. But we're there to provide a safe environment where we provide love, care, and understanding for people who need this type of service that is below a hospital.
Well, how is it different from a nursing home, per se?
It is. It's the same.
Oh, it is. Okay.
No one says nursing home anymore. It's all skilled
Gotcha.
nursing facility.
Gotcha.
And that's the reason for Pahrump Health is a skilled nursing facility or nursing home. But nursing home has so many negative effects to it anymore that we want to say skilled nursing. So, Karina, you have anything to add to that?
As a director.
For nursing, we provide that step down from the hospital. Whereas hospitals used to keep patients for 2 to 3 weeks after they would go in with an acute episode, and that's where we come in at. We still provide IV therapy services, medications, physicians come in, sometimes on a daily basis, depending on what the needs are of the patient. And we carry out those orders directed by the physician. Patients can stay anywhere from 7 days to many weeks. They may need long-term antibiotic therapy. They may need physical therapy to get them back to their prior level of function. And of course, they may need also long-term care stay.
Okay, that's what I was going to say. If they are in the position where they really can't function alone at home, it is, in that respect, like a facility where they can live, a living facility.
Oh, absolutely.
Yes. Oh, okay.
Yes, absolutely.
But they've got just a little more extra care, it sounds like, with the nursing on staff, and as opposed to what we were used to before.
Correct.
Yeah. Now, as far as family members, how can they connect or help out with their be a part of this whole process with their family member that can no longer be on their own and is being moved to a facility of this nature? Do they get involved with that?
Oh, absolutely, and we absolutely encourage that. Family members are very important. Of course, when they come into the facility, they're coming into our home, and that's the reason that we want them to feel like they are going home. We want family involved. Our caring staff, of course, provides that. They get to know the staff. The families come in and they're welcome anytime. Actually, we encourage as much family involvement as possible to keep that continuum going, that you're not just pushed out. You actually are still part and a sense of a community.
And what all do you have in your facility as far as for rehabilitation? What sources do you use or programs do you use to help people get back to functioning, even if it is a long-term stay or full stay?
We have physical therapy, occupational therapy, and speech, which we have a full therapy department. We can do all modalities of therapy that you could do in the hospital. So that is definitely a very important part of your stay to get you strong enough physically. And, maybe you've come in with a post-acute stroke, and you're unable to speak clearly, and your speech is typically with a very heavy stroke is garbled. So our speech therapists are going to work very hard to get you back to your prior level of function or as close to your prior level of function.
Right, right. Now, the cost involved with a facility like this, is it covered with insurance? Is it, well, you tell me. How do family members, or, is it cost effective? What can family members do to make, what are the answers to these questions?
Yes.
In other words.
Also on our therapy.
I'm trying to be polite, how to ask politely. Okay, how much do you cost? Or how do you pay for this?
Yes. Just a real quick on therapy. We also offer outpatient therapy.
Okay.
So they can do that also. As far as payment goes, there's all kinds of different forms of sources of payment. There's Medicare, there's Medicaid, there's private insurance, there's HMOs. So there's a variety of things to help people when they do need this type of care or service.
Mm-hmm. And that's all we're going to say.
Well, that's
no, I'm kidding. I'm kidding.
It depends on where a person is and
In
whether
their
they've
level.
prepared for it or where they are as far as in a Medicare or a Medicaid status. So and this is what we look at when someone is referred to us by a doctor. We start looking at their financial pictures so that we can recommend to them, what is the best way for you to go.
Right. Now, how long have you all been here in Pahrump with the facility?
Personally, I'm brand new.
Well, okay, the facility itself, how long has it been operating in Pahrump?
The facility has been in Pahrump roughly 11 years.
Okay.
Myself, I have been here for 30 days. So I'm new to this. I'm new to the community, which I absolutely adore, and I love it
But not
here.
new to the
No. I've been in and out of long-term care for 20 plus years now.
Yeah. So you do have the experience.
Yes, I actually.
You know what you're talking about, right?
Yeah.
Combined,
No, yes, I do.
Combined, we both have almost 50 years of
Yes.
experience in
Oh.
long-term skilled care as well.
Absolutely,
Yes.
absolutely. And so the facility, you've been with also here for a while, or are you new to the Pahrump area?
I'm new to Pahrump.
Okay.
2 weeks I've been here, and it's a beautiful town.
Yes. Oh, yeah, she's showing the picture. Before we run out of time, Brad brought a picture of his mom and dad. Why?
Well, they're seniors.
They're seniors.
And my mother, they both live over in Las Vegas. And my father, we have just had to place into a skilled nursing facility in Las Vegas. My mother is a senior tap dancer over in Las Vegas. She's been doing it for many years, goes to the senior centers and the type of business that we're in and dances for the people.
Oh, wow.
And
That's
it
great
is,
to know.
it's quite rewarding for her. She loves it a lot. She loves it a lot.
Now, you mentioned that your parents are obviously probably in their 70s, 80s plus. And what do you attribute to their longevity, or especially like your mom? Is it just keeping active? Is that something that you would probably say to people, stay active?
Yes, my mom has a big friendly heart, is what I will say. And that is a lot of, I would say, her success for staying the way she looks and staying young. My father worked very hard to raise all of us kids and whatnot. But as far as staying healthy, when you compare my mom and my dad, you have kind of a double-edged sword. You have good living versus kind of the business type environment that my dad grew up in. So
I think we're in the same. Yeah,
he's kind of suffering from that now, but mom is good.
And before we run out of time, I do want to ask you, Karina, the encouragement that you have with family members coming in. I remember a story when my mother-in-law was in a facility, and just the effect of having my son, who was at the time 6 years old, he helped them with a ball game, passing a ball back and forth to the residents. And just, you could see them being uplifted by having just that little boy be a part of their group. So, like you said, encourage family members to please, and you would allow them to be a participant in things like that with their.
Absolutely. We encourage family participation in developing a plan of care.
Now, where is the facility?
The facility is on Blagg Road.
Okay.
It's on the far end of Blagg Road at 4501 Blagg.
Thank you for coming. 10
Thank
minutes
you.
flies by and we'll have you back. And they are our new sponsor. And we'll be back after this commercial message.